of our interview with Angela Foran of Meridian Acupuncture. In this series of interviews, we discuss Dr. Foran's experiences volunteering in Uganda with the PanAfrican Acupuncture Project. The project trains local healthcare workers in Africa to use simple and effective acupuncture techniques that enable them to treat the symptoms associated with HIV, AIDS, malaria, and TB. This segment of our interview discusses the type of working environments that Dr. Foran found herself in, how she dealt with cultural differences, and the types of difficulties other volunteers may encounter on their own volunteer missions.
In terms of the work environment, were these training sessions taking place at local clinics, or were they even more, I'm not sure how small the villages were that you were visiting. Was it like in community centers, or was it actual clinics?
They took place either in community clinics, or one took place in a hospital, actually.
Okay.
The towns were fairly small, but a lot of people from neighboring areas would come because they had heard good things about what we were doing.
Okay.
And there were cases of people, like waking up in the middle of the night to walk 5 hours to come and try and get a treatment at the clinic. Yeah.
When you were in a hospital and the clinics, was it very basic services? Did you find that they had very little to work with?
It's hard as far as what we were concerned with.
Mm-hmm.
We had all of our own supplies.
Right.
But, getting other services, I don't really know. It seemed like they had medications for people, but it did seem it's different, compared to here.
Right.
It's
naturally.
It is definitely basic. And for our services, we would convert, quite a large space, like an open room, and just have some chairs and some tables, like hospital beds,
Mm-hmm.
and maybe some benches, and people would get treated wherever they could.
Right.
So we sort of made do with what people could.
And I suppose that sort of situation is common, and people didn't probably think anything of it, really.
Yeah.
Did you work, obviously you're training locals, so you're working quite closely with them. Culturally, how did that work out? Did you find it difficult to communicate and work side by side, or did you find that didn't make too much of a difference?
I think communication was fine. Everybody spoke English. There
Right.
were varying levels. And for me, I always like to learn about other cultures, so I find that's what's enjoyable.
Right.
Finding out how they interact with people, and just seeing the differences, basically. I didn't find that it was all that challenging,
Right.
I think maybe for some people it could be, because things definitely operated at a different pace.
Right.
There was some times where there was a lot of waiting, and it was, okay, well, what's going on? Nobody really seemed to know what was going on or who we were supposed to talk to.
Right.
But I think that can happen in a lot of cases, where you're a group of people going into another sort of organization or another setting and trying to set up things,
Yes.
Quite often, until you get things set up, there can be a little bit of chaos, and that was usually the case. The first day was often a little bit more disorganized, and then as the days progressed, everybody sort of knew what was expected of them, and
Right.
would sort of fall into their roles, and everything would run really smoothly.
So I mean, would you say that is, if for people thinking about doing something like this, that they would have to approach it in a certain way to really get fulfillment from the experience, in terms of being open to these different ways of operating and maybe not having expectations about the way things are going to turn out? Is that, would you say, a vital part of?
I think so, but I think that's important for any new experience. to not go in with like preconceived ideas about how things are going to work, or
Right.
yeah, I think the more open you are to new experiences, the more you're going to enjoy them and maybe experience more, you
Yeah.
know, because you'll just sort of let things happen. Whether, you know, for some people, being able to communicate really efficiently, I think, is really important, you know, and then they might struggle a little bit with that if
Right.
there's a language barrier. You know, some people may not be used to things not being as on time as they might be in North America.
Right.
And so that might be a factor. So I think it depends more on the person, maybe like their own characteristics or personality, and
Right.
yeah.
Great. Well, thank you so much for sharing your experiences.
If you would like to learn more about the types of services Angela provides to her patients, or to have a look at more pictures from her experience in Uganda, please visit meridianflow.ca. If you are interested in healthcare-related volunteer opportunities, check out the Resources Center at peoplemenders.com for more information and to find links to organizations you may be interested in working with.